begin our presentation with the United States. History and rationale for enactment. So for the U.S. healthcare system, it has evolved significantly over the past century. Initially, healthcare was primarily a private endeavor, with service provided by individual physicians and funded out of pocket by patients. The rise of employee-sponsored insurance during World War II, due to wage control, set the stage for the current system. The enactment of Medicare and Medicaid in 1965 marked a significant federal intervention aimed at providing health care to the elderly, disabled, and low-income population. The Affordable Care Act (ACA) of 2010 was aimed at expanding access to insurance, improving quality of care, and reducing costs. It introduced mandates, subsidies, and insurance exchange to increase coverage and affordability. Impact on healthcare of Americans. The ACA led to a significant reduction in the uninsured rate, particularly among low-income and minority populations. It also established essential health benefits, preventing insurers from denying coverage due to pre-existing conditions. However, issues like high out-of-pocket costs and disparities in access to care persist.
Impact on nursing practice and education. The shift towards value-based care and emphasis on preventative services under the ACA has broadened the role of nurses. Nurses are increasingly involved in care coordination, chronic disease management, and patient education. The demand for advanced practice registered nurses, APRNs, has grown, influencing nursing education to focus more on leadership, policy, and advanced clinical skills. Impact on nursing leadership and management. Nursing leaders and managers are now integral to health care reform efforts, tasked with improving patient outcomes and operational efficiency. Leadership roles in quality improvement initiatives, health IT implementation, and interprofessional collaboration have expanded. Nurse managers are essential in fostering a culture of safety and quality, aligning with the goals of modern healthcare systems.
Djibouti. Overview and history. Djibouti's healthcare system is primarily public, with services funded by the government and international donors. The system has struggled with underfunding, limited infrastructure, and a shortage of health professionals. Recent efforts have focused on improving maternal and child health, combating communicable diseases, and enhancing healthcare infrastructure. Access and coverage. Unlike the United States, where healthcare is largely insurance-based, Djibouti provides public health services to its citizens. However, access to quality care is limited, particularly in rural areas.
Health outcomes. The United States has higher healthcare spending and more advanced medical technology, resulting in better outcomes for non-communicable diseases. Djibouti faces challenges with infectious diseases and maternal health, reflecting its resource constraints. Nursing practice. In Djibouti, nurses often work in resource-limited settings where they focus on primary care and community health. The scope of practice is generally narrower compared to the United States, where nurses engage in specialized and advanced practice roles. Nursing education and leadership. Nursing education in Djibouti is less advanced, with limited opportunities for higher education and specialization. In contrast, the United States offers extensive programs for nursing leadership and advanced practice, driven by a focus on improving healthcare quality and access.
United States versus Djibouti. Longevity and life expectancy. The average life expectancy in the United States is approximately 77.3 years as of 2020, according to CDC research. This reflects a decrease due to various factors, including the COVID-19 pandemic. The average life expectancy in Djibouti is significantly lower, at around 67.1 years as of 2020, according to World Bank research. This is indicative of the country's challenges in healthcare and socio-economic factors. Top 10 causes of morbidity and mortality in the United States. Heart disease was the leading cause of death, accounting for about 696,000 deaths in 2020. The second leading cause was cancer, with approximately 602,000 deaths. The third leading cause was the COVID-19 pandemic, which significantly impacted mortality rates. The fourth leading cause was unintentional injuries, including accidents, leading to about 200,000 deaths. The fifth leading cause was chronic lower respiratory diseases, responsible for around 152,000 deaths. The sixth leading cause was stroke, causing approximately 150,000 deaths. The seventh leading cause was Alzheimer's disease, leading to around 134,000 deaths. The eighth leading cause was diabetes, resulting in approximately 102,000 deaths. The ninth leading cause was chronic liver disease and cirrhosis, responsible for around 51,000 deaths. And the 10th leading cause was kidney disease. Top 10 causes of morbidity and mortality in Djibouti. The leading cause of death and significant morbidity was lower respiratory infections. The second leading cause was diarrheal diseases, which are a major cause of death, especially among children. The third leading cause was neonatal disorders, a high mortality rate among newborns. The fourth leading cause was tuberculosis, which was a significant public health issue. The fifth leading cause is ischemic heart disease, which is increasingly prevalent due to lifestyle changes. The sixth leading cause was malaria, which was endemic and a major cause of illness and death. The seventh leading cause was HIV and AIDS, which is a persistent public health challenge. The eighth leading cause was stroke, which has a rising incidence as population ages. The ninth leading cause was maternal disorders, which has a high maternal mortality rate due to inadequate health care. And the 10th leading cause was nutritional deficiencies.
The U.S. enjoys a higher life expectancy compared to Djibouti, reflecting better access to healthcare, higher socioeconomic status, and advanced medical technologies. Djibouti's leading causes of death include infectious diseases like lower respiratory infections, diarrheal diseases, tuberculosis, malaria, and HIV and AIDS, which are less prominent in the U.S. This highlights differences in public health infrastructure, healthcare access, and socioeconomic conditions. Both countries face significant mortality from non-communicable diseases like heart disease and stroke. However, the prevalence of these diseases is higher in the U.S., reflecting lifestyle factors such as diet, physical inactivity, and obesity. Djibouti struggles with high rates of maternal and neonatal mortality, indicating challenges in reproductive health services and access to quality prenatal and postnatal care. These issues are less prevalent in the U.S. due to better health care services for mothers and infants.